I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, go into roll call.
Adam?
Mr. Beebe?
Here.
I'm sorry.
Willie.
Yeah.
Here.
Uh, Mr. Brooks is going to be absent. Commissioner Birdie.
He's not on yet.
He's not on yet. But Dr. Shovel will be coming on now. So, Tom Kelly, obviously. Okay, is there any call for changes to the agenda? Okay, hearing none, I make a motion to approve the agenda as presented.
I'll second.
I move in second to approve the agenda as presented. All those in favor?
Aye.
Aye. Carried. Okay, Vicky Purdy is, Purdy from, Adams County is now in meeting. Is there any in-person public comments? Okay. Then we're at introduction of new employees.
Commissioner, hello, Beth from Family and Clinic Services. I'm happy to introduce Karen Anderson, one of our recent nurse hires for Nurse Family Partnership Program.
Great, thank you. So glad to be here. It's been fun. I'm with Nurse Family Partnership and yeah, I love the clients and it's been great. Everybody here has been great.
That's awesome. Thank you. Welcome to the team.
Thank you.
We also have Jackie Penny is our new administrative assistant. Jackie.
Nice to meet all of you. I have watched your previous board member meetings prior to coming, so I'm kind of familiar with all of you, but I joined a few months ago, Southwest District Health, and I'm happy to be here. I support Ben and Dawn and help out with HR, and I just came to Southwest District Health because I love what we do for the community, and I wanted something that was more purpose-driven for the community in which I live in, which is Nampa. Right on the border of Nampa and Caldwell. So thank you so much for having me.
Thank you. Being on the team. Okay, any other?
I was playing with you.
Yeah.
Oh, I don't get Yeah, exactly.
You got it.
You don't understand with that? Sure, I'm staring. Yeah.
You know, it's like that.
Okay.
I can show you pictures that would make most of you throw up, so.
Please don't. I'll pass.
Just in the foot.
I'm sure.
I know. Okay, at this time, it's approval of the January 22nd meeting minutes. Is everyone chance to look at? I think I have a motion to approve the minutes.
Derek, will we approve the January 22nd meeting minutes?
And which moved and seconded to approve the January 22nd. This is meeting minutes as presented. All those in favor? Aye. Carries. Okay. We're on to the 26th, January 2020 monthly expenditure and review. Michelle.
Mr. Chairman. This report represents all the expenditures and revenues processed through the Luma accounting system as of January 31st. So we usually start up here on the left where the cash balances are, fund balances. So at the Let's see that, sorry, I just got off on my notes, my bullets. The cash balance for our operating fund is that $1,124,015. And the items below it are the amounts in our investment accounts. The total there would be 8.3. And moving over to the top right, the form there, our targeted percentage this through the state fiscal year, January, is 58.33%. The revenue so far just over 9.1 million, and the expenditures almost exactly equal that. They're about $2,700 on there for our year to date revenues and expenditures. This first page is all of our revenues, various programs, the different types of revenue that was collected for January. You'll see the budget revision that you approved last month hasn't been updated, and that second to the to the far right, second to the last column. That's labeled total budget. So that will be updated next month. So you'll see that percent budget to actual column, those percentages listed there will more closely align with where we're at for the fiscal year. Several of them you'll see are skewed quite a bit, but overall, the 53.74% puts us just under where our target is for the year. So pretty close to the target. Are there any questions on the revenue items there? We can move to the next page, which will show the explanation. And again, all of the programs are down the left-hand side, category of expenses across the top. And again, the total budget column, second to the last on the right, is still reflecting the original budget, not the revised budget that you approved last month. So again, a lot of those numbers that will be more closely aligned with the targeted percentage next month when we get those numbers entered in. But down at the bottom, you'll see our expenditures are at 53.76% of the budget, which is again just under the target. That'll more closely align next month, but it's almost exactly equal to the revenues for the year as well. For doing pretty good. Are there any questions on the expenditures here?
I do have one question. Do we have any revenues that might be impacted by what's going on in the State House? Budget cuts?
Yes, some of our subgrants, most likely. Affected by that, maybe not all of them. There's only a handful that are state funded. So it's hard to tell how they're going to shift their funding around at DHW, but we could be impacted a little bit, not as much as
the primary division that most of our subgrants come from. It has their budget setting scheduled for this Friday. So
You guys are tracking that closely. Yes.
Mm-hmm.
Thank you.
Do you have an idea? I mean, you said there's only a handful, so I don't want to ask you to name it, but which ones are going to be the most impacted?
I don't know for sure which ones will be impacted because that's really more a decision at DHW. So their state funds are impacted in certain programs, they can shift things around on their end. So I guess it's kind of really what they're,
And obviously the Medicaid cuts, expansion cuts are gonna affect everybody.
Yeah, we've already experienced some of that.
Yeah.
Cuts that have already happened.
Yeah, we're seeing it out in our county hospitals.
yeah, some of the programs we do collect Medicaid.
In our budget planning for this coming fiscal year, we've taken a lot of that into consideration. So
Smart.
Yeah.
would be meet next month to do a lot of work on the budget here.
Is there any more questions? Very good with it. Let's move on to, negative advice, Michelle. Tobacco and vaping prevention.
That's you.
Ivan Bailey. And there's just this passed.
Am I good to go?
Yes, if you.
Perfect. Good morning, Board of Health Commissioners. My name is Haley Ketchum, and I am the Program Manager for the Risk Reduction Team here at Southwest District Health. And I'm here today to discuss nicotine use in Idaho with you all and share more about the work that we are doing here at the district to help youth in our region build those skills to say no to nicotine and other substances, while also supporting those who are currently using nicotine to reduce or quit use when they're ready. Next slide, please. So a little bit more about our group. The Risk Reduction Team is a smaller unit within the larger community health team that lives within the Environmental and Community Health Services Division, and it consists of myself and two health education specialists, Raquel Nunez and Leanne Brooks. Next slide, please. So before we begin our discussion on nicotine, I'd like to provide a brief overview of what's funded. Historically, our efforts have been supported through two primary funding sources. So one through a tobacco prevention and control subgrant through the Department of Health and Welfare and the Project Filter program, and the other through allocations from the Millennium Fund. Traditionally, all public health districts have received funding through annual subgrants with Project Filter, and this funding was largely supported through federal CDC grants. Due to cuts at the CDC's Office on Smoking and Health recently, we did not receive a subgrant from Project Filter for this current fiscal year. And that amounted to around $70,000 in cuts to our programs. Due to these cuts, we are not proactively working on specific initiatives that were outlined in that subgrant, but we do still support these efforts if the communities come to us with those needs and ask for assistance. The good news is, though, we still have funding to support the bulk of this important work through the Millennium Funds. The Millennium Funds are pretty unique. The Millennium Fund was set up in Idaho after the Tobacco Master Settlement Agreement was finalized in 1998. It was the largest settlement in U.S. history, totaling around $206 billion in resolved litigation between tobacco companies, 46 states, and several U.S. territories. Today, Idaho continues to receive annual payments, settlement payments, and the Millennium Fund Committee within the state legislature reviews funding requests and provides recommendations to JFAC on which organizations and entities should receive those allocations each year. And historically, public health districts have been awarded annual appropriations to support substance use prevention initiatives. And as noted earlier, we did receive annual funding this year to support this work. Next slide, please. So moving on to the current issue, what exactly is the problem we are trying to solve? So because nicotine reaches the brain very quickly, within seconds, it is one of the most addictive substances known, and the effects of nicotine addiction are significant. Nicotine addiction causes cancers to areas of the body like the throat, mouth, and lungs. It is a significant contributor to heart disease and heart attacks. Causes respiratory issues by irritating the lungs, such as increased coughing, shortness of breath, and asthma, and can also cause reproductive health issues. Nicotine use not only causes physical harm, but it also causes significant mental and cognitive effects. It is associated with mood disorders such as depression, disrupts the body's stress response, heightens anxiety, and fosters psychological dependence. Because nicotine influences key neurotransmitters such as dopamine and serotonin, it can interfere with mood regulation and contribute to emotional instability. Withdrawal between nicotine doses further elevates stress, irritability. Among adolescents whose brains are still developing, nicotine exposure is especially concerning as it can impair attention, learning, memory, and emotional regulation, and may produce long-lasting changes in those areas as well. Although we have come a long way in decreasing the rates of nicotine use, specifically with smoking rates, any use of nicotine causes health risks for families and individual community members. Next slide, please. So looking at past and current trends, we can see that prevention and intervention work does make a difference in adult nicotine use. Data shared on this slide is from the National Health Interview Survey and the Behavioral Risk Factor Surveillance Survey. The BRFIS wasn't established by the CDC until 1984, but I wanted to show data from the highest peak of smoking rates in 1965, where 42% of adults in the US reported that they smoked. The NHIS data point from 65 is national data, but the rest of the data from 95 until our most recent data point in 2024 is specific to Idaho. So on this slide, you can see a glimpse into the nicotine landscape in Idaho. The downward trend for most types of nicotine use is promising. Since we have started collecting data on e-cigarette use in 2015, the trend has been slightly upward, and this could be due to a variety of factors, such as individuals using e-cigarettes as a way to stop smoking traditional combustible cigarettes, or decrease perceived risk that a lot of individuals have towards e-cigarettes. They do view them as less harmful. Next slide, please. So moving on to Idaho youth use, we can see that youth trends react to prevention and intervention program and policies. Data from this slide is from the Youth Risk Behavior Survey, and that's administered every 2 years to youth in grades 9 through 12. Both the YRBS and the BRFIS help to monitor behavior and health change over time, identify emerging issues, and plan and evaluate programs to support the health of youth and adults. For youth, the most recent data point we have here is from 2021 due to Idaho choosing to no longer distribute that survey to this young population. In 91, youth use of cigarettes was 23%, and we can see that steep decline over the last 30 years. In 2021, only 4% of Idaho youth reported regular use of cigarettes. In 2015, when we started recording e-cigarette use for youth as well, it was slightly higher than the peak of cigarettes at 25% of youth reporting regular use of e-cigarette use in 2015, but we can also see that decline over the past couple of years. For all forms of youth, nicotine use in Idaho use has decreased, again showing that importance of continued efforts in the prevention and intervention space. Some of the major milestones that could have helped drive nicotine use rates down among youth and adults include expansion of evidence-based programs within tobacco control, starting in the early 2000s after the 1998 settlement agreement was reached. Cigarette taxes, the Idaho Clean Indoor Air Act, which restricts smoking in public places. That happened in 2004 and was later updated in 2007 to include some of those exemptions like bowling alleys. Specific hotel rooms and bars are still exempt in most places, not all places. The Family Smoking Prevention and Tobacco Control Act in 2009, and that gave the FDA authority to regulate the tobacco industry, so helped with reducing marketing to youth, also banning flavored cigarettes except menthol, and then lastly, Tobacco 21, which raised the minimum purchase age of tobacco to 21 in 2019. So nicotine use has continued to trend downward for both youth and adults, which is encouraging and positive. However, tobacco use still remains a leading cause of death in the United States, and emerging research has also highlighted the harmful effects associated with e-cigarettes. It's important to recognize that the introduction of new and increasingly potent e-cigarette devices combined with high rates of youth use raises serious concerns about nicotine's impact on the developing brain and heightened risk of addiction for young people. While significant progress has been made in reducing these trends, continued efforts are needed to build a culture free from nicotine and promote healthier communities within the counties that we serve. Next
Can I
slide.
ask you a question before you run?
Yeah, absolutely.
I'm assuming that those numbers are additive, right? So the nicotine users are both, add them together, the cigarette users and the vape. We go back, yeah. So in 2015, it would be 35% of kids.
Yeah, so
users?
it's hard
Or
to
is that-
tell. Yeah, so like some might be both. I think we could get dual use information for you, but
But if not, it wouldn't bother. It's just, if that's the case, I mean, that's a huge percentage. And more than the number of smokers in like.
when it was just cigarettes.
Why did they stop surveying the kids?
Idaho just chose not to. I mean, there was, laws put in place like for, like needing parent permission, which makes it a little tricky. I don't know exactly. I could find out exactly why.
It was a legislative decision.
Right.
Question? Wasn't a concern? I think it was more around like, I was seeing some of the questions that were on the surveys, they didn't feel were appropriate for youth to be asked.
Because they were suggestive that they might not have thought of those things if they had looked at that survey.
Obviously, they were thinking about it.
Yeah.
And the youth risk behavior survey does cover like a lot of different.
Different stuff.
behaviors, so not just.
So I'm just wondering, so does this cover anything like the nicotine patches that are out there?
It does not. No, that's a great question because we have seen that be a huge issue, especially within like the high school population, like the Zyn pouches or.
Yeah. The e-cigarettes cover vapes.
Yes, that's another term for things.
Yeah, well, there's,
Do this, smokeless tobacco doesn't include the patches.
No, it does not.
I think part of the reason you'll see the downtrends in as long as parents, the younger parents are not smoking like my generation, makes a big difference. Kids can do what their parents do. There's a lot of parents now that no longer, don't smoke or never did smoke. And so I think the trend will continue going down unless the parents decide to start smoking again. But if they don't. And vaping, no one knows yet. We don't know all, it'll be just like smoking. It'll take years before they really find out how bad it is for the body. They do know that all that moisture going into your lungs is not a good thing, but they haven't figured out how much COPD is going to be increasing and all those other things that are going to happen over time.
It is still, fairly new. We don't have the data for years and years and decades like we do with smoking. Any other questions? All right. So Southwest District Health is addressing this need through 3 different avenues. So our programs are usually bucketed into one of these following areas: prevention, intervention, or cessation, with the majority of our time and space spent in that prevention area. And over the next few slides, I'll share just a quick, high-level overview of the different types of programs that we focus on within the risk reduction team. Next slide. So first up, prevention. The goal of prevention programs is to stop substance use before it starts. The focus of these programs is to educate youth, build awareness, and help them develop skills and tools to say no to using substances. We deliver prevention programs to all ages of youth, but we really do like to focus on and implement them with earlier on. So early on in late elementary or early middle school. So 5th and 6th grade is kind of that sweet spot that we focus on. And you can see on the right-hand side of the slide a few of the programs that we offer here at Southwest District Health. You can also see our mega mini inflatable lungs and brains that we take out to schools or health fairs and community events to educate youth and adults. And then now we're going to take a few minutes to watch a video highlighting one of our programs, one of the prevention programs called Catch My Breath.
is the evidence-based program that we offer to youth. And this program offers a lot of different types of education coming from the health effects, health consequences that can occur from vaping. It also covers advertising and like some of the tactics that tobacco companies are using. And also we go through refusal skills, giving students an opportunity to practice saying no if they were offered a vape, especially by maybe a peer or friend, someone that they know, so that they can have that opportunity and feel confident in saying no. We offer Catch My Breath to any school that is in any of the 6 counties that we serve. And that overall, we've been serving about over a dozen schools so far, and that we've reached over 1,000 students in general each year.
It's a lot easier to teach a kid now to say no than when they're in high school and the peer pressure is already sunk in and, oh, well, this is the cool crowd. I want to be a part of the cool crowd. I'm just going to do everything they say.
So with a lot of schools, they are very thankful that we are able to come in and provide this type of education, I think for a few reasons. One is being able to have that information available and just be able to talk about it with the students and feel comfortable is something that I'm able to do. And that also, this is a very necessary and needed type of program in the schools. The schools are really struggling with vape use, underage vape use. Beyond the Catch My Breath program, we also have inflatable educational tools, a very large inflatable lung and brain that we bring to community events and even to some schools that have already gone through the Catch My Breath program. Really, this is just an opportunity for youth to interact, learn some more information about the brain, and also reinforce that knowledge that they have learned about, tobacco or nicotine products and how those can affect the brain.
I think their biggest skill that they're learning from this is not only learning like beneficial refusal skills of not only saying no to a vape, but peer pressure and so on, but also going over the different health issues of it. So that way they learn now of, oh, I'm just going to try it once, why not, can affect you years. Getting that peer pressure of not only like older siblings maybe, but also family and, oh, well, my parents do it, so it's okay.
The epidemic of vaping itself has not gone anywhere, and that we're still seeing this in schools all across the region, that youth are being exposed to vapes, that it is accessible in ways that it should not be. That is, I think, one of the biggest concerns that I have, that I think that education needs to continue and that the products are just ever changing.
At this young of an age, they're starting to form their own opinions, their own minds, instead of just, well, this is what my family's always told me. It's, oh, well, I can now make a decision for myself starting very young on what route I want to take in my health journey.
For youth, so they are prepared to respond when they do accident injury. Peers or friends. The program is designed for 5th through 12th graders. Like Leanne mentioned, it is evidence-based and is modeled off of peer style. So they're working a lot in groups on activities and learning from each other. And it's setting and highlight health impact. In fiscal year 2025, we served 1,005 of our 6. Catch My Breath is the largest amount. This fiscal year, we have caught Catch My Breath in 4 of the 6 counties, and we are working with community partners to reach all 6. Next slide.
I see you don't have Adams County on here.
No,
There's a
we would
lot
love
to
to
do.
be in Adams County. We're hoping to get in with Meadows Valley School District
Oh,
this spring.
Well, I was just looking at your stats and that's
Yeah.
what I was.
Yeah, we just struggled to get in contact with the school. So yeah, great contacts up there. We would love to connect with them and those schools as well. Absolutely. Next slide, please.
He is sending a message. He just needs 1 minute while he switches.
Oh, gotcha.
There you go.
Thank you.
Thank you.
Thanks, Holden. So the areas of greatest improvement for the Catch My Breath program included student knowledge, understanding of e-cigarette tactics within like food marketing, and then also self-perception of addiction risk. The youth were asked to respond how much they agree or disagree with these following statements. So e-cigarettes, I would get addicted, and e-cigarette companies often exaggerate claims made about their products. And you can see from pre to post survey, kids improved by 10 percentage points for the self-perception of addiction risk, and then 27 percentage points for students' knowledge of advertising tactics by e-cigarettes. Next slide. Guiding Good Choices is another prevention program that is focused on reducing risky behaviors among youth through educating parents and creating stronger communication within the family setting. This program is for parents or caregivers of children ages 9 to 14. It's delivered over 5 different lessons lasting 2 hours each, so it's a pretty big time commitment for families. In partnership with the Valley View School District, we implemented the program with our first cohort in spring fiscal year 2025. 24 individuals participate. Families learn to strengthen family bonds, how to improve parent-child communication, what healthy conflict management looks like, and also how to share their own family guidelines at home. This fiscal year, we've implemented 2 additional cohorts with the Nampa and Fruitland school districts, and we served a total of 27 parents, and we have additional cohorts planned for this spring as well. And this is a fairly new program, so like I mentioned, we just implemented our first cohort last year. So if you have organizations or schools that would be interested, would also love to offer this to more families. Next slide. So up next is intervention programs. The goal of the intervention program is to address and reduce existing substance use by focusing on behavior change and supporting youth. We often work with schools to implement alternative to suspension programs and policy. So that is a situation where a student violates a nicotine policy within their school, and instead of either suspending them or giving them a legal citation, they're referred to an intervention program. And that gives youth the opportunity to address their current nicotine use and really support them in that quit journey if they're ready to do so. That provides them with education tools and resources to also make more informed decisions going forward. These programs are usually delivered in a small group setting or one-on-one with youth. And again, on the right-hand side, you can see some of the programs that we offer here at Southwest District Health. Next slide. So lastly is cessation programs. The goal of cessation programs is to support individuals who are ready to quit and help encourage abstinence from nicotine. These programs also focus on implementing behavior change strategies and supporting individuals. That biggest difference between cessation and intervention is the individual is choosing to attend the program and they have expressed that desire or interest in either reducing their use or quitting completely. Similar to intervention programs, they are offered in small groups or one-on-one, but often are delivered one-on-one with individuals just due to limited demand. Next slide, please. The last program I'm going to highlight is our NIC-Free Baby and Me program. So this is a cessation program that helps families quit nicotine while also protecting either unborn children or children in the home by decreasing those exposures to smoke and vapor. How the program works, first we receive a referral from either one of our internal programs at Southwest District Health, so WIC, NFP, Parents as Teachers, or externally from a community partner like St. Luke's. We then do an initial intake call with that individual and set them up for a coaching program. So that could be a pregnant mom or a new mom. It could be dad living in the home or a partner. It could be grandma, really anybody that's living with pregnant mom or new mom or an infant. The individual then works with their coach to quit. And once they quit, we start scheduling monthly visits where we do just a quick check-in with them, make sure, see how they're doing, how their quit journey's been, if they've been able to stay quit, or if they're struggling with that, we kind of reassess that and help them get back to that quit point. They do a quick little mouth swab just to verify that they are nicotine free. And then they receive their box of diapers and box of wipes. They qualify for those up to a year or 12 sets total. It doesn't have to be consecutively. Sometimes we find when mom has new baby, they're stressed out enough and have a lot going on and just can't even get here. So if they skip once in a while, that's fine too. Or like I said, if they slip back into using, then we just work with their coach and work with them to get back to that quit point. In fiscal year 25, we gave 142 sets of diapers and wipes to families and had 7 graduates from the program, meaning they completed a full 12 months or 12 times of those nicotine-free tests. Currently, we have 22 active program participants who are either working on quitting or have quit and are receiving their monthly diapers and wipes. Next slide. So as you can see, the risk reduction team provides support for families across the lifespan, starting from working with pregnant mom or new families to provide healthier environments for their babies and young children, to educating young people all the way into adulthood, where we work with and support adults who are ready to quit nicotine and provide parents with tools and resources to reduce risky behaviors among their youth. Next slide. So lastly, I just want to share a few ways that you all can help elevate this work. As county commissioners, you can help by connecting us with organizations that may need training on how to prevent youth from starting to use nicotine or how to support users in quitting through behavior change techniques. You can also promote the importance and need for evidence-based programs such as the Catch My Breath program or Guiding Good Choices to help support and strengthen families by giving youth the education and tools to make informed decisions. Another way to support this work is through encouraging and supporting smoke and vape-free policies in areas within your communities to foster healthier spaces for all, whether that's in county facilities, in spaces, or just within your larger communities. That is all I have for you. Any questions?
Question. I know there are other organizations, and we have one that's starting up in our county that is doing this kind of program. And I know Raquel is working closely with them, but how is Southwest District Health, are you training them and they're going into the schools, or is there redundancy in this program in the schools?
It depends on the organization. We work a lot with like our partners, so like American Lung Association, Idaho Public Television. We have like a monthly meeting they call the Vape Prevention Work Group, and so we bring all of those like different organizations together to hopefully not be duplicative in our efforts and work together. But it would depend on the organization.
1P Kids
Oh,
Succeed.
yeah. So we have trained different teachers within the school district. I don't think we've trained any like community organization staff. But I'm sure if Raquel is working with them that they know that we can help out with that as well.
They say they're going into the schools and doing some of this, and I just wonder if it's a coordinated effort or.
Yeah, sure.
1P, so my understanding of 1P Kids Succeed is they're focusing on like the youth well-being survey. So they're going into school, they'll put that in quotes, to understand like what is happening within schools. So they're partnering with the school districts in Payette County to collect data to understand youth connectedness and physical activity and substance use. And then 1P Kids Succeed will partner with other programming that can then kind of support what that data tells them.
Okay.
So it's 1P Kids Succeed is like more holistic. And then we may be one of those partners that like provide that specific
But they're
education.
You're talking to each other.
Correct.
I mean, I know Raquel is, but.
Yeah. Yep.
Another question?
Yeah, I just wondered, so I noticed people that smoke now, and I have a family member that does, is how much time it takes. I mean, if you're in business for yourself, my husband and I are both saying, how do you take that much time? So they take a break, go smoke a cigarette, come back, work for a little while, gotta have another cigarette, take a break. And I mean, they don't smoke around their kids, or other family members anymore. At least that's something good. But I mean, has anybody ever actually thought about how much time it takes in a day for all the cigarettes everybody smokes when they go outside to do that? I mean, there's no way I could have. I don't like it anyway. I grew up with parents that smoked, but who would have the time to do that? That's my question. Well, yeah, and the expense, is it a lot more expensive than it used to be? It's like, does that stuff ever resonate with people? Holy cow.
Very good points. Yeah, absolutely.
Commissioner, I do know that a lot of the nicotine vapes, like one hit is equivalent to one cigarette. And so you can get your nicotine hit very quick on the vape and not have the reduction in productivity, unfortunately, which would have been a nice thing to maybe help prevent it. But I think the vapes have circumvented some of the productivity loss
So you think it's just the nicotine or is it more the habit? Because some people, I mean, it's like a habit. I mean, it is a habit, but you know, I mean, I don't know, it just seems like it. Yeah.
If you, I used to smoke, so you'd get up in the morning, you have a cigarette, you have a cup of coffee, you have a cigarette. But it takes about 3 days meant to get over the nicotine itself, and the rest of it's in here. A big portion of it's here mentally, just like all addictions, whatever you're addicted to. Most of the time it's due to what your mind says. Yeah, smoking, like I say, habits, or when I'm driving down the road, depending on what I was doing. After I ate lunch, I had a cigarette, but I smoked pack and a half a day. So.
Yeah, some people have compared it to even like losing their friend, like that we've worked with. You know, they've smoked since 12 years old, and I think it's a combination of that addiction piece, but also just
I did
comfort.
both. I did both cigarettes and chews. So
What's the cost of vaping relative to
I have no
cigarettes?
idea.
Does anybody know?
Yeah, it's hard because they have like I don't know, if you've seen like the really big devices or the disposable devices. It varies.
But for kids, is it cheaper to get to vape than it would be to buy a pack of cigarettes?
A lot of them get them like from friends. So I don't know that a lot of them are actually purchasing them. Yeah. They'll just like kind of share devices between each other. And those kids that have them often get them like from family or.
and it's where they go to.
Are you doing any work with high school students?
Yeah. Yeah. Like
You mentioned the 5th to 6th grade.
Yeah, we just try like with the prevention work to get like in front of them before they even be in like exposed to it stuff. So yeah, we definitely work with a lot of high school students.
Do you have some cards with you?
Some like business
cards?
I will go get some.
Okay, thanks. I'm gonna give you some help.
Perfect. I love it. Any other questions?
Have you approached the schools and they just haven't been interested? We don't have that many schools.
Yeah, it just depends. Sometimes it's just a scheduling conflict, like if we don't get in contact with the right person at the right time. Sometimes it's taken like a year or two just to get into the school. They have busy schedules, they have a lot going on, what they have to, curriculum wise have to provide to their students. Sometimes, it's a matter of getting in front of the right person that, thinks it's important. I feel like most people know it's important, but again, if they just have competing priorities. Any connections that we can receive, we would love to have.
Is this the first year you've done this?
No, for Catch My Breath, I believe we're in the 3rd or 4th year. So this is a program that we've had around.
And you try to go once a year to the schools? Or?
Sometimes we go twice a year. So especially because a lot of the times we'll go into like a health class. So usually health classes are just one semester. So we'll hit like the fall and spring semesters, and just again depends on the school. Some of our rural schools are set up a little more different. So we do just come in one time. It just depends on like what class that we're going in there. But usually they'll choose like, okay, we want to do like all of 8th grade or all 7th grade. Sometimes all of middle school. Just depends on the school. But yes, we all also go into a lot of the high schools.
And he's correct with, just like anything, the schools, they set up prior to their year, they have a schedule for everything that's over your thought. If you didn't go in there and get on that schedule, you have to wait pretty much a year before, unless something else falls apart, and then they'll get a hold of you. But it usually takes at least a year to get on their schedule. So, and it's just because how the schools run too, is they're a government entity also, so they have to show certain things to the government. Although they're a government, they still have to show that they're doing all these things, and there's sex education, all these other things that they have that's required to have also. Anyway, thank you.
Yeah, thank you all.
Thank you.
Appreciate it.
Now we're going to move on to the fee schedule approval.
Yeah.
Thank you. Last time you approved this was in 2024. And so over the past 2 years, we did decide to update our methodology. The methodology prior was we used the Idaho Medicaid fee schedule as the base for calculating our listed charges. We're moving to the Federal Centers for Medicare and Medicaid Services. It's nationally recognized. The main differences between the two is Idaho Medicaid actually uses the CMS fee schedule for how fees in our clinic and behavioral health services are adopted. They just reduce that base as Medicaid, but use a uniform multiplier to inflate that fee schedule to allow for when we see clients that have commercial payers, Blue Cross, Regions, et cetera. So the request today is to adopt this new methodology for the service delivery we provide in medical and behavioral health services. The policy is broken down by, there's a section for fee methodology, or special cases for fee setting when it's only a Medicaid covered service, cash only services. We have a couple of those, and then also includes our self-pay and sliding fee application for individuals who meet certain federal poverty guidelines, and what discounts they may receive off of the fees. So it's kind of complicated, but I'm happy to answer any questions. And again, it sort of mirrors what Medicaid did. All provider healthcare entities typically use this fee methodology. The federal government assigns a value, they call it a relative value unit. So they evaluate the work expense. So if Dr. Tribble is here, he would understand this. So the relative value unit for the work expense, meaning a primary care physician has this kind of value, emergency doc has a different value, a brain surgeon has a different value. So that's one part of the component of this fee schedule. The practice expense, so what does it cost to either provide this service in a facility, meaning a hospital, outpatient, like Treasure Valley Hospital setting, or a clinic such as ours, and then the malpractice insurance. And then they assign values each year, and then they have to add a monetary value to each of that. So then you can create a base so that emergency room doctor is going to charge you more than primary care doctor, and what that looks like. So that is the methodology. It supports transparency, accountability, audit readiness. Another reason we moved to it.
Can you remind, and you've said this, but can you remind me again what the previous methodology was?
We use the Medicaid fee schedule, Idaho Medicaid fee schedule, which they also use the CMS fee schedule and then adopted it. The difference here is that it's a little bit more work, but now that we have our finance team, it's easier to pull all the procedure codes for certain things. So behavioral health has codes, the physician services have codes. The thing to note with the behavioral health codes, because they are reducing by about 20%, is when we first established this, when we asked the board to approve behavioral health services here for our counselor, we did not factor in that we're only providing master level clinician counseling. Our physician does not provide behavioral health counseling. So that is the adjustment. The change from 2 years ago to now is 5 to 9% plus or minus on physician office visits. So if you're coming in for a wellness exam or a comprehensive exam, it's plus or minus 5 to 9%. There's a 13% increase in our procedures or ancillary services, a 5% increase in lab fees, a 6% decrease in immunizations. We also removed COVID because of last year's board decision to remove that. It was just on our fee schedule, so removed it. And then, as I mentioned, for our behavioral health methodology change, about a 23% decrease to those listed charges to align with the provider type that we have here. And then the what?
Which ensures that your claim is approved, right?
The claims get approved. We were just billing a little bit too high. So what happens is you bill $300 to all the insurance companies. Medicaid pays you 80.
Right.
Medicare pays you 100.
Right.
Blue Cross of Idaho might pay you 150, so regardless, you still have a contractual adjustment that is just part of how healthcare billing works. Yeah,
Which is crazy.
yes, yes, yes. And it's complicated and, yeah, but anyway. So the request would be to approve this methodology, and then the list of fees that you have right now, those are all the procedures and services that we've provided fiscal year. But also if we do add services or medications related to the scope of service that we deliver, we wouldn't come to the board because you're approving the methodology. We would just say, oh, we're also going to do, you know, we're now removing bunions. That's a strange example, but like it's a removal. We might not have that billing code on the list, but we would just apply the methodology to then create the standard charge.
So the methodology didn't exactly cover our cost before, right?
Oh, no, it did.
And it does still.
Mhm. Well, let's define cover our cost. We're not a private primary care model. So our makeup of the clients we see today are about 40% self-pay. So they have no insurance. Depending on what happens this legislative session, that could increase with Medicaid expansion if that it really does end. The other about 30% are Medicaid. So, and then the rest of them are a mix of Medicare and commercial, Blue Cross, Blue Shield, United Healthcare. So using the CMS and or Medicaid as a base, and then having a uniform multiplier to make that still within range. We may not, like some of the codes, Blue Cross, we might have got $10 more, but to make it more reasonable for the clients that we see and the patients that we see in our region, our multiplier is 175%, where you'll see many other entities have anywhere from 200% to 300% on top of that. But based on what we do, based on the nature of, you know, we're trying to see fill that gap for folks. So the most vulnerable folks that we serve. So it doesn't make sense to overinflate that because you also use that base to then create that self-pay like sliding fee schedule for those that are at certain percentages of the federal poverty guide.
That has over time, has the self-pay gone up or down?
Up. We're seeing more self-pay. Yeah.
But we use the Medicare thing.
Some in part, some, there's a variety of reasons. Some don't want to choose to like get on the exchange and buy insurance.
Prices went.
It's not required anymore. You're not getting a penalty on your taxes if you're not, you know, so there's people a lot of people that are relatively healthy that might need labs done or birth control or things like that are not going to spend the money for potentially catastrophic care. Well, if I get in a car wreck, then what? The hospital is going to see me anyway. So that's Beth's opinion. So
That's interesting.
yeah.
No,
Just
it's
to be
very,
clear.
it's a huge,
It's like auto insurance. People drive without insurance because they own a car that they are not titled to, or
Well, the cost is so high and then the
Yes.
deductibles are so high.
Yeah.
So
because
they
insurance is
figure out pretty
racket.
fast.
Yeah, you have
Yeah.
$3,000 out of pocket when you can pay a couple $100s to see a physician and get labs done. And then, you know, there's a lot of pharmacy discount programs. So folks that are, you know, on lifelong medications, you don't have to have insurance. There's a lot of, if you look at your retail pharmacies, a lot of pharmacy programs where folks can get discounts that are outside of kind of like the big insurance healthcare.
You know, but it is a racket. You go in, you have insurance, your bill will be.
4 times the cash.
Yes.
Right.
Well, I
Yes.
went and stayed overnight in a hospital. Boise. Surgery and that on my neck. It's about $250,000 for me to spend one night. If they're with the extra on page 12. I mean, that's just, I don't understand. I don't understand it. It doesn't make sense to me. So that person that doesn't have insurance, gonna pay $255,000 for staying overnight at the hospital?
No, they get a cash price and then they'd apply for charity care in the hospital and then the hospital would write it off for bad debt and then they can recover that through some of their cost reporting methods through like on the federal side, the Medicare side. So it's very complicated. Yeah.
Sounds like it.
Yeah.
It makes no sense.
Yeah.
Why is
It's not common business sense.
Why do they have that price?
They have so many different prices. Yeah, it's ridiculous. And the people that have insurance, pay for the people that don't. And
Like
it's,
anything.
yeah, exactly.
Yep.
It is the worst racket ever.
Smoking
There's definitely opportunities in healthcare.
Yes, well, the health sharing, the industries are,
Yeah.
are far better. If I didn't have-
The co-ops.
We had that before I was commissioner.
Going on a hope and a
And
prayer.
it's so much more reasonable.
Yeah, we can.
Clean your nonprofit.
Well, I look at, are we positive at the end of every month, even if it's 10 grand? We just talked about our hospital. I sat on our hospital board for a number of years and
Oh, sure.
the finance part just, as a business person, it's mind boggling.
Yeah.
Because it's not normal.
Right. No.
It's not normal P and L. It's not
No.
normal, pro forma. It's just not normal. It's, smoke and mirror, Medicaid, this, that. God love you and CFOs that run hospitals, because I have no idea how you do it.
Yeah, if you go to Treasure Valley, they'll give you that cost. Great.
Yeah, I think that's awesome.
Yeah,
And that is
they're,
that's a good example of a non-hospital based facility where the facility fee there is going to be a lot less. Like if you look, there's like a list of 30,000 different codes, and so you talk about patient choice and like, oh no, hey, I want to go somewhere where you're not paying all that additional overhead, but there's pros and cons to all of it. It's great to have major hospital systems that, are.
We need them.
Yeah, absolutely. So.
So what is?
What my request is
The motion to
approve the fee policy and methodology as written for this version 2. And then if we have any new codes or changes within the umbrella and scope of services that we provide, we would just use this
So
methodology.
you want the titles, it'd be the fee policy for policy 3.01.
Yes,
Is how you want.
version 2. Yes.
And I
Please.
guess for motion.
make that motion.
Okay, it's been moved and seconded that we approve the fee schedule of policy 3.01. Is that a good number?
Version 2.
Version 2, all those in favor?
Aye.
Motion carries. No, good, good.
No, he left. And then Ben has a set of fees also.
Yeah, good morning, everyone. So, not quite as complicated. So that's nice. Though I know Commissioner Brooks is here. He can have a few things to say about some of the initial stuff here. We're talking about, our calculation of cost and then the fees to provide said service. So at the first page, here is our facilities and our food service. And those are all set in statute. And so we can't really change any of that. So that is what we charge. Same for our childcare. Our swimming pools did change earlier this year with NAPA only adopting some regulation that allows us to continue in their area. And so we were able to amend our fees to adjust for actual costs. And that has been going well. And we hope to get other cities on board if they would like inspections. The bigger bulk of this is on our land and subsurface sewage programs. We have had no changes in the methodology to look at our costs. That has been the same since my predecessor Folds has been here. I think it last changed maybe 04 when we went through the fees. There are changes in their costs, of course, since 04, and those are all reflected there. But today, we're just asking for a couple of changes for some changes in fees. On the far right-hand side of the column, page 2, the first one is in regards to our installer licenses, both basic and complex. We are requesting a fee increase for that service, just based on our cost to provide services. And you can see also the third column over it has our current fee and then what the new fee proposed is. So there's 2 there. Below that, there's also our accessory use permits and for office review and field review. Same thing, we are requesting a increase in fees for those just based on our current cost to provide the service. And then finally, on our last page, highlighted in orange, that one is different. That's actually a proposed new fee. We haven't had that one before. What we've run into is we will sign off on different permits and engineering that has been done. And then on site, at some point with the developer and the landowner, they will change things and not follow their own plan and then ask us to then approve the permit, which means we have to go back out there and relook at all the engineering and make sure that their change that wasn't part of the original plan still fits within all of the adaptive rules and guidelines. And so we're just asking to charge for that service. We don't get too many of those, and we're hoping as we charge that maybe we'll get even less of that happening and people will just follow the original plans. And so if you look at where that orange is and then go up to those 2 costs that are also part of our subdivision applications, those fees are all about the same because our time to process everything is about the same. So we are just asking to amend all 3 of those to basically could be the same just for consistency's sake. And finally, our last request is on the subdivision applications. Again, it's just trying to align more with our cost to provide the service. And so we're asking for a fee increase at that location or on those applications as well. And that, I believe, is it for now as far as any potential changes. On the solid waste, that one I think is up in legislation right now to see if that's going to stay with us or go back to DEQ. So no changes in the from that either till we, state would like to do.
I think that the state's going to take it back over, but my guess is the districts will still be doing all the inspections.
That is mine and especially Mitch's feeling as well, talking to some of his DEQ partners, that they probably couldn't handle the workload. And so, and I think many of the counties frankly prefer us because Mitch does great with his customer service to you guys and
they don't have the manpower to do it, so.
Right. We still do the inspections and they do the compliance. Is that what you're saying?
Well, I think that that's what would be the best, but I don't know how that's going to work out in the long run. But I always have a problem with the state of Idaho doing the hammer, but they don't care about the little places that we care about stuff. So.
Is that in the statute then? Because I looked over that statute. I didn't see anything in there about.
For the, as far as the solid waste.
Yeah.
Yeah, I believe it's a separate section and I don't know which number it is offhand.
It's a long.
Yeah, and so they would just revert it back to control to DEQ. In effect is what would happen.
I don't know how many years ago it was given to the district health, but then they had it then and then they gave it to district health and now they're taking it back.
Right.
Yeah.
Yeah, but that new statute that makes sets that, yeah, I don't know. It's a big bill. I might have missed it, but I looked all the way through. I didn't see anything about allowing health districts to
Yeah.
do the inspections.
It says they could subcontract, or they could contract with other entities to complete the work, basically.
It's an applied task.
Yeah. So if something like that were to occur, we'd probably just get an MOU with them.
Right.
And proceed with
Keep
whatever
doing it.
they would ask us to do.
Right.
That would be my guess. So, there is gonna be the ability for them to just do it to anybody, but since the district's health have been doing for so long, they probably stay down. They utilize it now.
Yeah, especially initially, because it goes into effect July 1st and they wouldn't be ready.
Right.
Well, they've already been cut. Not hiring anybody, so they've already been cut, so there's no way they can move forward.
But that bill has some funding in there, some additional funding.
They're gonna increase, they're gonna add tipping fees.
Tipping fees.
Right.
And then there's another aspect of fee collection too. I don't remember what it is, but it sounds like the fund.
So it's a ton.
Yeah, the funds would end up going to DEQ and then they would basically just contract with the districts to do that.
We're the only, this district here is the only one that already has fees. So all the rest of the districts don't have fees. So we're gonna get double hammer.
No, because we're not gonna charge you.
Well,
We would eliminate our fees.
yeah, we'd have to eliminate our fees.
Yeah.
Because we're already charging our taxpayers fees. You have a solid waste fee. All of us in this district have a solid waste fee.
And then we would get paid directly through DEQ at that point.
Similar to how our the public water systems contract works.
But then, we don't know our fees are pretty much set in statute. So I don't know what their fees are gonna be.
Well, I think if they're gonna contract with us, we tell them what our cost is and then they reimburse us for our cost.
Yeah. Well, our costs.
Let's just wait and see.
No, our
I
costs.
can find somebody else to do it.
Yeah, our costs through that statute are like at least 4 times what we're paying now,
Mhm.
going up by a lot.
Yep.
Yeah, it is.
We charge by cost and it's like right now, I think we're at $67 per year for a resident. That's
Really?
Yep.
Wow.
Ours depends on the type of varsity, yeah.
Now, if you're a business, it's double that. We just double businesses, now they pay double. But for us, that's our fee. I think we're at $67.
I think we're at 160 on our property taxes per year. And, you got a garbage service, you pay for that.
Right.
You take anything out there to dump, it's got a fee to it. Starting to get ridiculous. My concern would be that people would start leaving their trash on the side of the road.
That's why it ended up going
I
to district health pickups the bar. Yes, because of that very thing.
Yeah.
That was where it was.
We just had somebody abandon at our cycle, fifth wheel shell of a camper. Like, really, who just drives out there and drops their,
Because they don't want to pay the fee to dump, yeah.
yeah, I don't know, the sheriff's looking into it, see if the ben's registered to anybody. Of course, it's usually never been registered, so
Probably, yeah.
I don't know if that's gonna go anywhere.
I
but-
see some of that.
There we got one sitting. BLM will end up.
Yeah.
General taxpayers will.
We'll end up eating it.
Yeah, it was, they dumped it about a week ago. It's still there.
We've had some issues with Illinois land. And I had a question, I'm sorry.
Go ahead.
In your pre-development meeting, was that supposed to be $100?
That is different than below where where you see the pre-developments.
Yeah, no, I just,
So it is supposed to be, we had looked at maybe making a change there and we did not make a change.
it just was the only one that had a new fee that wasn't different.
Wasn't
That
different,
was
yeah.
saying that's
So we
the
decided
current
to
fee, so I
keep
just
that
wanted to make
as
sure that wasn't a typo or something.
Yeah, no, thank you. No, it's meant to stay the same.
Okay.
Yeah, I guess my question is similar. There are a few on here that are actual cost is quite a bit more than the current fee that aren't changing. So is there any reason not to raise those up while we're?
Yeah, sometimes there are. So, and we actually discussed this a lot. So a great example could be, on our septic permits. So you can see that our septic permit cost runs about $1,125, and we're only charging $950. The reason that is we're trying to balance compliance with non-compliance. And so sometimes once we hit a certain level, we start at a certain point, we're afraid they're going to stop coming to us and just put it in illegal.
Just like our trash.
Right. So we're trying, because our real goal is not necessarily to make money. Our real goal here is to just cover the cost and make sure that the environment, the water quality and all that stay the way we would all like it to stay. And so when we look at the different fees, some of them are kind of like psychological, in our view, we're trying to just get compliance. And so if we're afraid that if we raise them too high, then we might see a lot more. And we do get illegal septics put in all the time that we're policing and trying to enforce and do all the things. And so we don't want that to increase. Was there one in particular though you were looking at?
Well, I just looked at a bunch of these. None of these have fees. The tank only, permit renewal, technical guidance manual, and all of that is all of that covered under the same idea.
Yeah, and some of them are kind of all rolled in. So like when you look at the permit fee for the public license and stuff, or additional truck, they're the current, they're close. And so which one specifically? The table?
The tank only is, it's off by $100 and.
Some of these are really number driven, like we have 50 behind them and there's like, we only do a few. So it's not gonna like really break the bank if we don't change it. And then some are also, I'd say like also kind of volume driven, like with as much growth as we've had and our staff really working at max capacity. We don't need to raise like the permit fee right up to what its actual cost is because we're super productive. Now, like if there was a decline in growth, just like if you look at going to the dump, you're going to collect less, right? And
there's a little
that balance.
Yeah, there's a little wiggle room with because of the productivity. So our costs, we stay the same. We have the same amount of inspectors, and then there's, let's say we're assuming like an 80% productivity. And if it gets super busy and we flex up to 95% productivity, our revenues will go high, but our costs don't. And now we run into the problem of, we're actually close to making money. We're not supposed to do that. So we try to factor that in based on the volumes too, which isn't shown in this, but I have a whole separate spreadsheet that looks at volumes and trends over the last 7 or 8 years. Just trying to predict like averages, I guess. And so sometimes we haven't changed them just because we do a 10. And so it doesn't really move the needle too much. And so it's not, I say we're changing it. And others, we have to be careful because if we do have a flex up, we can drive it, of course, until we run into the issue if we burn our guys out. So we have to always look at our staff too and not overwork them. But they stay quite productive over in that team. It's a good team.
Well, the moment the fee that we're charging more than what the cost is, the state of Idaho will come after us.
Right. Yeah.
That's just how they work.
These for developer fees, the pre-development meetings and some of them aren't far off, but the pre-development meeting, maybe that's encompassed in your re-engineering, but cost is 155 and not raising that one.
Yeah, that one, that's the one that we didn't change the one. And this one probably had the most debate. And so, see if I can explain this well. So when there's 2 separate charges here that are kind of lumped into one that we do. So there's one where we're getting from the county, when someone's going to say like put up a barn somewhere, they have to go to the county and get certain signatures from like the irrigation district and the highway district and us to sign off, and there's not going to be any issues. And so when we process those ones are fairly fast for our guys to kind of go through, they pull up the the picture of the area, looking for wells and irrigations or anything that might be problematic. And if there doesn't seem to be anything that's problematic, then we can sign off on it and you know, conditional, like, yes, go ahead and proceed, and then they'll have to re-permit after. Some of those, and so that doesn't take as much time. Some of them can take quite a bit of time that are a little bit different, not coming just from the county, or there is going to be a couple issues. And so we can help them, and then that fee actually gets tacked on to, like, if we're going to move on to the pre-development side evaluation at that point. So they'll pay the $100 and we'll say, oh gosh, this is complicated. We're gonna have to go on site to maybe dig some test holes, do some exact measurements, things like that. And so we'll apply that $100 fee over to the one below it for the pre-development site evaluation. And so it's really $700. So instead of, we were getting such a fee schedule, instead of having two separate fees, because we thought about breaking them up and they were both going to be $100 either way, because we don't actually, you know, that $100 for that more complicated one is actually $800 at that point. We just thought it was easier for everyone just to keep the fee the same, knowing that if it goes complicated,
Yeah.
we're going to be charging for $700.
So the cost to provide service is really,
It varies slightly.
yeah,
Especially.
it's not a hard and fast. It costs us 155 and.
Yeah, there is always some wiggle room, because also, you know, transportation is also, we have to average that out. So, we know if we're gonna go out to Hawaii County, we've got drive time we have to account for on mileage, but Hawaii County is large. So depending on where we're going, it can vary by quite a bit. So we've calculated some averages and just tried to do our best based on past work. So it's not, like, as much as we want it to be 100% accurate,
Right.
it's really not a way.
I talked to Mitch about this, and there's also the fact that if we're going in and we've already done a lot of work on an area and are going to do some re-engineering, it'll be done without travel, be done in-house. And that was why he was wanting to go down this.
Oh, the $100 fee.
Yeah. And he doesn't have to do the on-site because they already have all the information, but they're redoing something, and so he can just do it all.
Yeah.
We try as much as we can to not drive out there, because it's definitely cost prohibitive to do that. But if we do, then that's where we have the other fees to try to recoup that, because usually that means we're doing more than just measurements. We're probably getting test holes. The guys are out there even several hours.
Right.
They're digging a test hole and taking samples of the different dirt and stuff like that. So it can get time consuming.
I just hate to see us not charging what it's costing us for some of that
Correct.
development. And
So in the other spreadsheet that I have, what we do is we culminate all that information and try to see, okay, as the program sets, are we making money, losing money, or breaking even? So we're real close to that break even mark on paper. Of course, if something changes in the economy, then it could change, but we're pretty dang close. And so we try to take into account that the psychology of some of the pricing, our estimated costs, the volume of the services, and then kind of roll it up all together and say, okay, well, as a program, if someone's looking at this, are we making money, losing money, or net, even? And we shoot the even mark.
I know that in our county, we want to charge what things cost us, but some of those fees haven't been changed since 70s.
Yeah.
And they just, once they're in there, they don't get revised, so.
We're trying hard to, also creep them a little bit, instead of doing that, oh, we're not going to touch them for 10 years, and all of a sudden, bam, they're double.
Right.
Yeah, we're trying to just.
But most of these were before 2020 or, so.
Yeah. Yeah, luckily, we've also worked real hard at, obviously our employee costs always tend to go up, but we've also, we've done a good job on our productivity side of things. So with our new software system, I don't know, I think that started in 23, maybe 24. And so there was a large learning curve. And now I think some of our time to do some of these things is reduced, which is great, which is also why we've been able to keep our team same. They're running hot, but they're going to keep the same guys without having to increase that spend too. But if everything keeps going crazy on the building side, we might be coming to you for a request for another.
Don't worry, AI. It's actually can be very useful. I'm sure you'll find ways. I'm sure you're. I know as a lawyer, I was because I'm older, I was kind of skeptical, but I've got younger attorneys that go, oh no, watch this. And they show me and I'm like, wow. I mean, something that would take me 2 hours takes 45, 50 minutes. So cuts your client's costs in half, cuts your time in half.
Yeah, I think that's something we're always looking at as far as the AI use, and we've
It's gonna
got,
be interesting to see what it does.
our IT team has been helpful to make sure we have all the compliance part of AI, because that's part of the issue, that some of that just gets shipped out to everybody that wants to see it. But we've got the Copilot. So
Yeah, Copilot's inside your firewall, so that's what we use.
Same.
Yeah,
So it's
doesn't go out to the interweb.
right. Yeah, that was the big
People
worry.
can't see what you're working on.
Any other questions about these things? And I guess we're just requesting to approve it.
So let's move that we adopt the proposed environmental health fees.
Okay.
It's been moved and seconded that we approve the proposed environmental and health fees as presented. Any further discussion? Hearing none, all those in favor?
Aye.
Okay, motion carries.
Thank you.
I get a water. That's like,
Yes, thank you for asking.
Free of the meeting, move on to our next item, and it's communications year-end review.
Alrighty, good morning, almost good afternoon. I don't like, okay. I'm Monique Evancic. I know most of you. Tribble, no. And I'm our public information officer and communications manager. And then each year I do kind of a year in review. So you're kind of staying aware of mostly the media coverage that we've received and what we've been working on. So feel free to ask questions as we go. Okay. So I handle our internal and external communications. I don't do all the internal. Katrina and Nikki do a little bit of that too. Handle our public relations, and then also any kind of program promotion to raise awareness about the services we provide in our community, to gain enrollment and participation and that sort of thing. All right, next slide, please. Okay, so we're going to kick off with media mentions. Last year we had 53 media mentions. So that can be in newspaper, TV, radio, whatever. There may be more. We don't use a media monitoring service because they're super expensive and then big national brands. But with the technology that we have in my own eyeballs scanning through newspapers, there's 53 that I know of. In comparison, the previous year we had 90, but that was an anomaly because it was after the, y'all voted on the no longer offering the COVID vaccine. And so that created a big uptick in media, if you remember at that time. So looking at the year prior to that, 50s more in the, so it's pretty typical. Next slide. And that's Southwest District Health, not all the like health districts.
Southwest District Health, just us. Good question. This is a smattering of local media outlets. I'm sure many of them are familiar to you. Some of our hyper-local ones are the Louise for Signal American, the Record Reporter in Adams County, Emmett Messenger Index in Gem County, that sort of thing. So some of the usual suspects here. Next slide. Oh, and then regional and national media outlets. So that's what these look like. KPVI is out of Pocatello. Big Country News is in the Palouse region. State's Newsroom is a nonprofit, nonpartisan news organization, and they report from every capital. So they're nationwide. EMS1 is an online news source for the EMS community, kind of, or EMS about EMS. And then Citizen Portal, this purple one is interesting. This is purely AI. So they're a website, and what this AI platform does is it scans all public meetings of any municipality nationwide, and then it'll basically do a transcript, publish a transcript, and then create a concise summary and publish that of whatever the meeting was. So this is an interesting new AI platform. So we'll pop up on that here and there, and you should look into it for your own county meetings and stuff like that, because I'm down there as well. So that's kind of new on the scene. Next slide. These are some of our top headlines. These are actual headlines. They're not my summaries. I'll call attention to a couple of them. So on this first one, we made a decision to no longer send a press release out when we have the first flu death of the season, and we talked with the emergency preparedness team on that as well. We're trying to balance that, keeping people informed so they can make healthcare decisions for themselves and their families, but also not fear mongering. And we try to listen to the feedback that we get, you know, on social media and such. And this was one of those where it was like, okay, we've been used to doing it that way, and we announce it and kind of kick off the season. And we do see, providers do tell us, hey, we do see an uptick in people getting the flu vaccination once we report on this. But also we got some feedback of like, oh yeah, we know it's, you know, it's sad, but it happens every year. It's common. So the last couple of
couple of seasons here, we've tried to dial that back. And so we're not sending press releases out. If the media inquires, of course, we'll respond and give them the information, but we're not going to actively do that. So that's just a choice we made, and we're kind of feeling it out and seeing how that plays out. Adams, the HCHAT is the Adams County Health Action Team. They did offer some mental health resources for EMS and council. Some of you may remember the Youth Crisis Center that opened in Nampa. I know some of you have taken a tour of that nice facility. And then the pre-prosecution diversion program that opened up in Payette County. So those were some of the cool highlights. Next slide, some more headlines. Oh, the paramedic program in Washington County, that was really popular. That got quite a bit of media coverage, and it was really cool that the first one in the state was in Washington County. You know, it's not like, oh, you think Canyon County, Ada County, whatever, kind of the places you'd expect. And so that was a really good hook and angle for a lot of media coverage on that. Even a paramedic, she was getting wiped out with doing media interviews. And then I'll also call your attention, I'm going to talk about it more, but tick season. Your people are interested in ticks. We have found that is wildly popular. So there was also on social media and in our newsletter, and it was just, so we did, you weren't here, Commissioner, but we did a tick drag. And so our employees put our bodies on the line, not me, of course, but all our brave employees went out all over the district, collected ticks and checking the different species, and we got photos of it. And I mean, it blew up on the internet. It was one of those things that just kind of went viral.
Lyme disease.
Lyme disease, yeah, Rocky Mountain spotted fever, all kinds of ickies with that. And people are very interested with their pets. We had a lady that uploaded a photo in the comments of her kid that, like, what is this rash? Did they get bit by a tick and stuff? And we're like, we can't read this medical information on the internet. You know, so we referred her, but I mean, people were very, very interested in this and engaged and telling us, hey, come, this is where I go hike. Come there next season or go there, giving us tips, or what about this place, or, you know, whatever. So anyway, that was wildly popular. Is that tick drag? Is that something the district does every year or is going to do it?
We're going to do it more often. So it's something that hasn't been done very much in Idaho across the state. But it's something that we've had interest in doing. Well, I've had interest in doing for quite a while because of reports of Lyme disease without out-of-state travel. So I'm just kind of like, we really need to understand what's happening with tick populations in the state and the pathogens they're carrying. So our team is really excited to do some surveillance. And we got a lot of volunteers across our teams that aren't like people that are, because it's not super technical. You don't have to be an expert.
You wear a
So,
white suit and so you can see him.
you can, and yeah, you should wear something so you can pick them up. Because I actually wore my beehive suit. So
good idea.
And there were ticks crawling on me. So they're easy to see.
You didn't use traps, you just.
You use it's called a drag because you literally drag a cloth behind you over the brush and your ticks will jump onto it.
Oh, wow.
All you gotta do is walk through the.
Yeah, I was gonna say.
That's right.
Yeah.
Pretty much. The drag helps with a little bit more, but there are a couple spots that we went where you could see them just hanging off blades of grass and you could just go up and stick them in the dust.
And they are deadly.
Pretty crazy.
Yeah.
Did
we have
my house?
Yeah.
That you've been out fencing in the hills.
I will say the one challenge that we found, and I know I'm hijacking your presentation here, but that we submitted our ticks to CDC for pathogen testing, and it took like 8 months to get the results. I hope that's not going to be always the case, but I know they've been going through a lot of changes.
Did they all come back clear?
No, they did. They all came back negative, which as I think motivated our team to get back out there and try some more. Plus, all of them were the same species, and we know we have different species of ticks, so we're going to try some different seasons at different locations.
Have you seen deer ticks?
Mm-hmm. Yeah. So
Where did you
more to
guys
come.
go?
We went to a couple spots in Canyon County. I think we did a couple spots on the Weezer River, but although I think we went a little late. I think we did that in the fall. Our fall tick drive was not successful. Our spring was much more
There's a
successful.
place out past Middleton, then went to Lake Wool.
Oh, yeah, we went up to Emmett too.
Amen.
Yeah.
Anyone want to have a guess on where the most by far ticks were?
In Celebration Park, we went up.
Lake Wool.
Yeah, that doesn't surprise me.
So highest population, most going there, and most ticks there too. Yeah, they're smart. Where to go?
Late in the summer, it's pretty.
Right, because we do those, the algae bloom.
Yeah.
And
The herbicide and fertilizer that's in there.
all right. Okay, next slide. Okay, so moving into social media, since we were talking a little bit about social media, I'm going to dive into this a little bit deeper than I have in years past and explain why we participate in social media. And so part of it is a tactic in our strategic plan that we want. It's a great platform to build the public's trust and confidence in what we're doing. Our website is very official, but social media is where you get to peek behind the curtain a little bit, see the names and faces of the people that work here and what we're doing and what, out in the community and that sort of thing. So we demonstrate our value to the community, increase program awareness, emergency communications, especially on Nextdoor. Are you familiar with Nextdoor? Because I talked about, okay, great. And so that one I can just send out a boil order, say, to a certain neighborhood or area, or just have content that's relevant for one particular county on some event that's happening there now, to spray it as far and wide. And then we can also issue alerts as well. And that one is less of a pay to play platform than Meta, which owns Facebook and Instagram. So anyway, so those, and then we'll go to the next slide, please. We'll talk about the channels that we're on. So we're on Facebook, Nextdoor, and Instagram, and these are about the followers they have within our district. There are 96,000 members or so on Nextdoor from 61,000 households. So we can really, we've got a lot of reach with that. Yes. Do people actually look at it? I know I've had this conversation with you before, but I've talked to some people who have Nextdoor and they said, I don't look at it anymore. It's just all ads and whatnot. Do people actually look at it, interact with it? Yes. So I would say probably not every day, like they would through Facebook or something like that. But the impressions, when I send something out district-wide, it's anywhere between 4,000 and 12,000 impressions. So, you compare that to 96, 60, 90, it's a small number, but it's a much bigger number than
15% is not bad.
Yeah, and then with the thing with Facebook is that their algorithm, if you don't pay to boost a post, nobody sees it. Yeah, it's less than 5% of those 2,000 people. So it's a better value to participate in the store for us. Okay, next slide. All right, so our content strategy. Oh, I got cut off, I'm sorry. So number one is to create local content. That's what performs the best. That's what people want to engage with. And so we're focusing more on that. This year, we've got a new submission process in place with our staff to kind of engage all of our staff in submitting some kind of content. They have a week each year, and so they can kind of help me out since we're a small communications team here. So that's first and foremost. Second is sharing content from other local organizations that have clout, that are reputable, that the content is relevant. So for instance, you come in here, you see all the traffic on the highway. So we share ITD's posts, and they do monthly posts on what that is. And so that it's great cross promotion of these brands, so to speak. We are then, from a brand recognition perspective, we're then aligned with another familiar, reputable brand that builds relationships with them. We don't have to reinvent the wheel. If DEQ or ITD, they're going to talk about canal safety, then I don't have to also create my own post on canal safety. I can just share theirs. or whatever, that sort of thing. So it saves us some work as well. And then finally, the third thing is leveraging social media toolkits. So that's kind of what this piece is, where it might be from, we get from WIC. They give us social media posts that every month. I'm working now with so there's the America 250 campaign that's going on this year. Idaho's got their own. And then within that, there's a Move 250, and it's kind of a goal to move 250 miles this year. Some of it can be on our scenic byways and stuff like that. So I am working with the Idaho State Historical Society on behalf of our 7 health districts and Department of Health and Welfare to create a social media toolkit that they can give us so we can participate and promote in that. So that's going to be another neat thing that's coming up here. These toolkits are great sort of content filler. They don't get the engagement that we get when we post something just ourselves. You know, people can kind of tell. But like I said, we don't have a dedicated social media team, so we've got to work with what we have. Next slide. And this is an example of the local content. So during this last year, during Public Health Educators Week, that's a thing, we posted 5 videos, 1 per day, with the community health team. These little bitty videos got 2,000 views versus this video from Samsung got 50 views they sent us. So it's a big difference. Here's an example of the tick post on Facebook. We reached 2,700 people, 771 engagements. That's likes, shares, comments, pictures of their body parts, all kinds of stuff. And so just really high engagement, which we love to see. Oh, and we do some sentiment tracking as well. This is purely anecdotal. This is just kind of monitoring when we post something, especially if it's something that could be kind of polarizing or something like is it the fluoride, you know, for kids or things like that. We're kind of monitoring, okay, how are people reacting? How are they receiving this information? What are those conversations amongst themselves looking like? So that helps inform how we approach what our messaging is in the future and what are people concerned about or interested in or whatever. And then I'd say overall, I started about 3 years ago and I'm coming out of COVID, the amount of trolls or irrelevant snarky comments on things has gone down significantly. And I don't know if it could be a combination of we're just moving away from COVID and, you know,
Nice.
yeah. And I think I think some of our content and what we're putting out there and that sort of thing. And there's just less talk of that. And so, because it used to be where we post something on diabetes prevention and somebody would make a COVID, you know, just kind of out of the blue, whatever. So we've seen a big reduction in that, which is great. And instead positive comments, comments of gratitude of the work that we're doing, sharing more of our information. Our Google reviews have been great. It's just consistent 5 stars over the years. So anyway, continuing that reputation building. Next slide, please. So our e-newsletter, all of you should be subscribed to it. Have you seen it? No? Okay, let me make sure that. So we send it out every month and we have over 12,000 subscribers. Most of them come from environmental health and community health. We do collect some quarterly from our patients and our WIC participants, but because it's HIPAA, I can't just opt them in myself. They have to opt in. Everybody else gets dumped in automatically and they can opt out if they want to, but many don't, which is great. And our average open rate is about 38%. For perspective, that's really high. And the industry average just overall in marketing, 30% is like you're cooking with gas. And so this, we're being totally unsolicited, not totally, but mostly, that's really high. So we're proud and we want to maintain that. When we
included the tick drag on here, it was 46% open rate, which was incredibly high. And then the second highest one was the food pantries. Remember when the federal government did the shutdown in December, we created a list of all the food pantries in our district, and that got a 42% open rate. So people were very interested to know where that was. And then just other topics, we usually include about 3 per month on things that we are promoting. Next slide. Last slide. So this just goes a little bit more into my public information officer duties when I put that hat on. So I serve on our preparedness team here, and then I also participate in the Treasure Valley Communicators Work Group. So that's PIOs from this whole area, and we meet quarterly. And then I'm the chair this year of the PIO work group for all of the health districts statewide and Department of Health and Welfare. We meet monthly. And then through the Idaho Office of Emergency Management through their peer team. So we meet periodically. And if there's ever some kind of crisis, let's say in Lewiston or something, and it's a big deal, some big disaster, and they don't have enough PIO team, then we can get deployed over there to help them out. So I participate in that. And then lastly, these photos here are from the Treasure Valley Communicators Work Group. We hosted them in August. We had dozens of public information officers and communications managers from all over the Treasure Valley, a lot that are even statewide because they're headquartered in Boise. And we gave them a very interactive experience. It was very well attended, well received. A lot of the staff here helped me with that. We did an escape room situation where they had to identify, solve the mystery of a lone hiker's death, what they die of. We did soil demonstrations, kind of a dirty job situation with all that stuff. We did, a travel through time. You might remember our timeline that we did.
Was that the same event or was this a different?
Different event. We just kind of recreated, cherry picked some of these neat things that we've done from the symposium before. And so then these folks can then, not only they're the mouthpiece for their organizations, but now they're educated on what we do. And so they can share what we do as well and our services and a lot of cross promotion. We meet quarterly, we troubleshoot, we share best practices, that sort of thing. So it's a very valuable work group.
Question, doing another symposium? We did it this last year. It takes a lot of time and effort. Yeah. And our original target audience was legislators, and we just haven't had them really engaged. So that's thinking that it could get our. But so I would say we won't do it again, but I think let's kind of evaluate it. Board input on that would be great too, if you guys think it's worth doing. But maybe with a new election, we might have some new legislators coming out this year, so maybe doing one and this year might be. If we have some new ones. Yeah, we'll see.
I've lived in this state too long. Because everybody moved here and changed everything. I go move somewhere where they're not that.
I don't know.
But where is that?
I don't know. That's why I got property in Arizona out in the middle of nowhere, and I got property in the middle of White County in the middle of nowhere, so.
You're starting to sound like a country song.
It's pretty sad.
Mama never got run over by a train.
Well, you gotta add to that song too. To get the perfect song.
That's funny.
Any questions I can answer before I go? Okay. Thank you. Anything you need, I'm available. So you got my email address if something comes up or whatever media related or something. Happy to work with you.
She's a great resource. I've worked with Monique on several different things when we were going through what's going on here at the county and at the district. Been great to work with. Thank you.
Oh, thank you. Thank you. All right. Have a good rest of your day.
Hey, retention review.
Hi, good afternoon, technically. A few minutes past noon now. I'm gonna scoot back up. That's okay. So yeah, my name is Jody Waddy and I work in human resources here. And so I want to thank you for allowing me to come and chat with you guys about employee retention and our compensation assessment. I'm hoping to share with you kind of where we are, what we've been experiencing, as well as how we're responding to retention and turnover rates. And so in your packets, you have this employee statistics sheet, as well as some key takeaways that will be summarizing what I'm sharing with you guys today, so you can have that as a future reference. But for now, let's turn over to the employee statistics for fiscal year 2026. Our fiscal year, as you guys know, is July 1st through June 30th of the following year. Most of the trend data I have in this document are from fiscal year 2025, so July 1st, 24 through June 30th, 25, as well as calendar year 2025. So I want to highlight our trend alert for employee turnover in the upper left-hand corner. For 2025, it's at 30%. And yeah, that seems like a really high turnover rate number. I do want to call out that that is a slight increase from the previous year. We were at 21% the previous year. However, when I look at the last 5 years of our trend data, we typically vacillate between 20 and 50%. 50 was during the COVID season and we had a really high turnover, but typically 30 is kind of where we're landing. Also on there highlights State of Idaho's fiscal year 25's turnover rate, and theirs is 14.6, so it's significantly different than ours. One of the pieces that could contribute to that is that they have a lot of movement within state departments and agencies, and the turnover rate only is calculated by those who actually leave state service, where we have not as much opportunity for movement around here in just the health district. So people typically move to other agencies, other departments, other programs, other employers, and so therefore our turnover rate looks a lot higher. Shooting over to the side there, the recruiting market. I do have 3 years of data there for you. We were on the higher side for filling vacancies in the previous couple of years. We had 33 vacancies filled and we had 32 separations processed. So we are actively recruiting as soon as positions become vacant. We don't like to leave them unfilled for too long. Our goal is usually 6 to 8 weeks to fill a position from the time that someone turns in their resignation upwards, and then we get to refill that position so we can minimize our impact, our delayed services, if you will.
Do you know what the primary reason is when people leave?
Yeah, definitely. We offer exit interviews to those who are offboarding. They can do it one of two ways. They can either fill out an exit survey that comes directly to me. We relook at the information, share what's relevant out of it, or they can meet directly with Nikki and provide one-on-one feedback to her. I think there's a good mix of both. Nikki and I chatted about it, and the driving force seems to be wage. You know, we have a big competition in the valley here for wage, and so they're leaving for other opportunities and pay. They're driving force. Yeah.
Suffer from the same.
We do. Yeah. Preaching to the choir.
Unusual.
Of those 32 separations processed, we had 5 retirements this past year, so it's a little bit higher than in the previous years. That can kind of skew our number a little bit. 19 of them left for personal reasons or going to the private sector, and private sector. We had 5 return to state service or some other kind of local government service, whether it be city or county job. And then we had 3 dismissals this past year, so that kind of made up the bulk of it. So yeah, when we're looking at the why of it, of those 19 left for probably higher pay elsewhere. When we look at the positions, though, of the people who are leaving, they typically fall in the healthcare industry. So we had lots of clinical assistants. Those are frontline WIC workers. We had some registered nurses, some registered dietitians, and medical assistants leave us past year. So we worked hard to fill all of those. And our current 6 vacancies that we hold are mostly frontline support. We do have some clinical assistants in there, but they're office specialists, things of that nature.
Looking over at our employee turnover, our average tenure, kind of tiny to see on this screen here, but for calendar year 2024, we averaged employees had been with the district for 5.5 years. So they were hitting that magical mark where they're now invested with Percy, getting that long-term benefit of that retirement for life kind of a deal. For 2025, it dropped to 4.5. So we're losing employees before they make that long-term benefit. Again, we did have higher retirees. They all had significantly long longevity with us, so that could have skewed my data. But what that tells me is that pay and benefits is pay predominantly is a driver, limited advancement. We are public health, we are small, so we wear multiple hats here, which is wonderful, gets to gain lots of experience and do lots of different things, but there's not a lot of opportunity for upward advancement unless someone retires or leaves. So therefore, people have to look outside of our organization if they want to grow in title, grow in pay. And because we are high achieving, we have most of our staff in the exemplary category. They're working at a high level of efficiency all the time. And with that could come some burnouts. That could be a contributing factor to why people leave as well. So when I factored all the people who left of those 32, took out the retirees, I wanted to see how long were they staying on average. About a year and a half. So we're losing people in that 1 to 2 year mark. So if we can like hone in our efforts in this first 2 years, we have a better chance of getting some longevity.
That seems like it's got to be more than pay, leaving that soon.
Yeah, it could be. It's like they get into the organization. They could be applying for other jobs elsewhere. They're taking the more immediate need fill because we were available. We offered a position, but they're still searching and headhunting elsewhere, and then they get a better offer somewhere else and leave us. So yeah, so below that I have some just cost of living information. Gas prices in the Treasure Valley has gone down in the past year. Although I think it's back up to what, 3 something now. I saw at the pump the other day, or no, 266 I think at Walmart the other day. I don't remember, but it's decreasing by 9%. Mortgage interest rates have also dropped down to 6.1% previously. Still on the high side, but at least it's on the downer side. Home prices in Canyon County have gone up by 6.5% for the past year. If you want to highlight, I pulled out some Ada County data. The average home price in Ada is $562,000 for 2025. We have about 50% of our staff living here in Canyon County and the other 50 in Ada. There's a few smatterings in our outer areas. So that's a huge jump between Ada and Canyon, but those all drive the reasons why they're looking for pay outside of this organization. So yeah, so it's kind of where we are, what we're experiencing. What questions might you have before I move on?
I'm a little surprised that the home prices have gone up that much in the last year. It seemed like they'd stabilized but gone down.
Yeah.
Is this across the district or that's
It is.
Canyon?
Yeah, that's for Canyon County. Yeah, that's since most of our staff live here, we wanted to focus just in these 2 areas here, but
the ideal to get retention, what do we believe is the best way to go about trying to get retention? It's just funding or just the almighty dollar, or is it other things?
I mean, pay goes a long way to get them in the door, right? And to get them to stay. But once they're here, employee engagement matters big. So keeping them engaged in our workforce. So the benefits that we can offer, trainings, higher learning education, things like that. Long ways. Is anybody else have anything to add to that? What you're seeing in your areas?
You said most of them or bulk of them are in the health clinical.
Yeah.
Part. So those jobs would pretty easily jump to.
They are.
They're comparable.
Yeah, and when you look at our like clinical assistants, they're in the medical field. It's really an entry level position, and so we're competing with them being able to go work entry-level office jobs and make the same, if not better wage. And so it's hard to retain that when we have other competition.
Good information.
Yeah.
Thank you.
You're welcome. So some retention strategies that we've already implemented is just to continue to stay focused on our benefits, spelling it out for employees to really encourage them to see the value in the benefits that we do offer. So that total compensation, that total wage, inclusive of their pay and the other benefits that we give them. Recognition for the great work that they do in the health district, that means a lot. And also trying to focus on employee engagement, as they're doing now. Some of those recognition programs are the Bravos. Bravos is a platform where other employees can do a shout out on somebody who's gone above and beyond. Gets collected in our weekly News You Can Use newsletter for all staff. And then they get celebrated quarterly at our all staff meeting as well with a certificate, as well as an opportunity to get some cool swag. And then this current year, we implemented longevity awards for employees making those milestones of 5, 10, 15, and 20 years. They now have the opportunity to choose a one-time $250 bonus or a day off, whichever is the best value for them. And so that's been really fun. And continuing to look at compensation to stay fair and competitive in the market. So those are some of the strategies we're working on now. Looking ahead at the overall compensation landscape, some things to just kind of be aware of is last year, the national average increased by 3.4%, inclusive of wages and benefits as well. So we're seeing an increase in compensation. And then Office of Group Insurance, they administer our benefits here. They're projecting an increase of 14% for employers and 9% for employees on our premiums that we're going to be paying in the next coming fiscal year. So yeah, that's the, yeah. And those are directly influencing our employees' decisions on whether they stay, right? Healthcare is expensive. Yeah, and while we offer great benefits, the cost can not always keep them here, so.
What, have you had any feedback on this opting out of Social Security? Has that impacted retention at all?
You know, I haven't heard that be a driving factor at all. Employees haven't shared that with us. And now that we've been in it nearly a year, people are actually starting to see what's in their little bank account. I think it's actually kind of exciting to see that money grow. So I haven't heard one way or another.
Well, we were kind of afforded an opportunity to do it the one time because a couple of years ago, 2022.
For everyone?
Yeah.
For the district?
Yeah. Yes. Because we had to separate, we were at the state's tax ID number. And after 2022, we had to separate and establish our own tax ID, which triggered us having to vote on whether to continue to participate in Social Security.
It's not an individual decision.
Yeah.
It's the district and it's forever. So it's a one time.
Wow. Should give that to everybody.
Yeah, it's an amazing benefit. You bring them, you would bring them.
Exactly,
Yeah, you would bring.
because it's a racket too.
Social Security, you would bring Social Security.
They take our money, convince you not to collect it, and then they spend it on frivolous
You know,
stuff.
originally it went in the lockbox and then the legislators saw all that money sitting there. And
Yeah,
decided that
gave
they
away the
needed-
keys.
They needed to utilize that money and now we don't, I mean, had it stayed in the lockbox, that fund would have been probably close to 25% more to 30% more than what it is today. It would more than fund everything and we actually do those that are on Social Security, but it'd be getting a much higher
Return. Yeah.
Mm-hmm.
If you put your own money in an investment account, you'd be making a lot more money.
Oh, yeah, especially
than what they
now.
give you, that you will never collect, because most of us will die before you get your money back.
Yeah, I'll have to be 80, almost 90 years old before I get my money back.
Yeah.
You better stay out of that.
And motorcycles.
Thank you, guys. I appreciate that.
You kind of walked into that.
Oh, anyway.
Yeah, your county likely had a vote back when it was established, and once they vote yes, it is a permanent, lifelong decision to contribute. When we have a no vote, we have the opportunity to go back and re-vote again on it in some time. But, yeah.
Interesting. I didn't know that.
Yeah, but not vice versa. Once it's a yes, it's locked and loaded. The driving force really was the government pension, so that's what makes us eligible to vote.
Interesting.
We had presentations, both sides, so.
Yeah.
Everybody got the full, or as much full information as.
Exactly.
I mean, it was-
Presentations were so skewed
Oh, I know.
towards social security.
Were they?
Oh, of course.
Yes.
But most everybody, so you could see through what Social Security was trying to do. It was pretty easy to see what they were trying to manipulate. Anybody that watched it.
Well, if you didn't have a lifetime of experience with social security, I'm not sure you would know that. If you were 25 or something.
Maybe, that 25-year-old grandkids, they all understand it. They know they're never gonna get a penny out of it, so they try not to put any money in it.
Anyway.
Yeah. Well, that's just the information I wanted to share with you guys today. I mean, overall, our recruiting is strong. We're getting positions filled regularly. It's the retention that seems to be a challenge for us. So I'm trying to focus this coming year on that and dive into some strategies to maintain the committed and engaged workforce so we can serve all of you guys and our people. So, yeah. Any final thoughts, questions, concerns? Before I leave you guys.
Thank you.
Thank
You're welcome. Bye. Enjoy the rest of your meeting.
Hey. Contract services and grant applications, Don.
Great. We've had some discussions in the past regarding increasing visibility to any grant applications that we kind of have eyes on, and to bring that forward to the board, just so that you have an opportunity to see what we're looking at as well. We set that threshold, or the request from the board was to set that threshold at that $50,000 limit, because we do occasionally apply for smaller grant applications, $5,000 for this particular focus thing, but just to make sure that we don't create a lot of noise in this, setting that at that $50,000 threshold. So these are the ones that we currently have on our radar screen. The information at the top, kind of above the gray bar on the well, there's a gray header at the top, but about midway down, there's a gray bar. The information above that gray bar we talked about last time. So we'll kind of show you, hey, what did we talk about before? And then the information below that gray bar is the newer items that since our last discussion on that topic. So you can see we have some there related to not gigantic funding opportunities. There is one there in the Rural Healthcare Services Outreach section at that $750,000 threshold. That's a pretty exciting one. It's also probably going to be one that's more competitive, right? Because higher opportunities where there'll be more people throwing their name in the hat for that. We have not started that one. It is one that we are interested in applying for. You can see over there on the right-hand side where we're at with those. That one at the for which C is in process. And that's also a pretty nice one, right? For that first year, 300,000, year 2, 200,000, year 3, 100,000. In addition to these are the ones that that are related to business within the district itself. Diane, as a kind of refresher there, Diane is our grant writer that we were fortunate enough to be able to bring on. She works half-time. And because it's a very competitive landscape right now for grants from the federal side or from foundations, she's keeping her eyes peeled, but there just is not as many opportunities out there. And so because we have some additional hours for her, she's also been working with each of your respective counties to see if there are some opportunities where we can be the person that bangs out the application for you, for some to maybe help with EMS services in the counties or maybe ADA compliance, because I know the needs are high and sometimes you're also stretched very thin in the counties to maybe not have someone to devote to that service. So she's been working with each of the counties over the last few months to, help, hey, what can we help you with? And then begin those discussions. So I didn't put those on here because they're all, I think some of them are less than that $50,000 threshold. But also, I think the discussions are still in the preliminary stages. So.
Don, are these, some of these going to be applying to that for the rural health grant money, or is this before? I mean, that's not on here yet. Yeah.
Yeah.
But we will be, yeah.
So I don't know if there's action item here. There's not a lot of surprises with the way I'm looking at it. These are exactly what we were hoping to have Diane help us with, keeping our fingers crossed that we'll be selected for some additional funding and be able to deliver services and help folks in the communities.
I think it's a great thing. Just keep going. And thank you for giving me all that information.
Oh, sure.
Get it out to my first responders. So thank you.
Yeah, and as a reminder, the subject matter expertise, maybe that's not in Diane's wheelhouse. She can help collect the information from some of your folks on, hey, give me some language, and then she'll flesh it out. She does a pretty good job giving it. If you give her a couple bullet items, she can expand that out into a grant application and then provide that back as a, hey, this would be my draft statement of purpose and scope of work. So there may be a little bit of back and forth. She can't do every bit of it without some input, but I think it should be a good partnership, and it's an easy thing to do to help us all work together.
And she's been a big help to us.
Yeah, if you need anything, if you're waiting on anything from her, please don't hesitate to reach out to her directly, or you can send a note to me and we'll huddle up and get your needs met.
Thank you.
You bet.
Okay, moving on to the Executive Council update.
So we have been meeting every week. There are a couple of bills, and without, it's all written down here, detail, but there are a couple of bills that have to do with cottage foods and direct to consumer, which attempts to just kind of exempt from any regulation or licensing or anything, individual sales. As I understand, Nikki, that this cottage foods, which exempts anything that sells any, I guess, income to a seller that's less than $5,000, including these time and temperature controlled foods. But there is still some liability potentially to the seller.
In the cottage food operations, yeah, it doesn't give them any protections from lawsuits if they made people sick.
Right.
The Senate bill below that does give protection.
Right. Yeah, and these are in process. The cottage food one is sailed through the Senate pretty easily. So there seems to be a lot of support in the legislature for this. There are a number of bills having to do with land use and accessory dwellings, subdivisions, and there's a whole package of these bills, but they seem mostly, for the most part, they've been held up in committee. So whether they'll be reworked and kind of exempting counties from some of that remains to be seen, but it didn't make it out of committee so far. And from IEC has told us that there's just an enormous proportion of bills this year that affects counties. So these are just a handful of ones that may affect health districts, but there's just a huge number of bills affecting counties. Rats, this is a weird, this is a strange one, but it is designating the Norway rat and another one as potential pests for abatement. But where there are rats, you'll never get rid of them entirely. It actually says something in the bill about eradication. You'll never eradicate rats.
Eradication.
Yeah. There's some others here. The one I guess I really want to mention is the kratom. That was announced. Yeah, and the health district did have a resolution. This is a strange bill that they've developed here because it kind of produces some carve outs for whether they contain other unnatural products, and so it still allows sale, like even in convenience stores and whatnot. So seems marginal to me, but it also sets a minimum age to purchase of 18, which is still lower than cigarettes and alcohol, so kind of strange.
Well, I think your comments were probably right on that there's probably, the industry is probably behind that though. Just to
Seems
protect
like
the
it.
state from banning it, which some other states are doing.
Right. But we have been meeting and had a lot of discussion, so. Greg, did I miss anything?
I was just gonna add, because I didn't get into this update, the abatement, there was an abatement bill that I didn't include in here because it had been held in committee, but it sounds like it's coming back.
Yeah.
Coming out of Gem County.
Yeah.
I know all about
Jim County.
it. It's not Jim County, it's
One
an
person.
individual
Yes.
who moved here from out of state who is driving this. They want to eliminate mosquito abatement in the
Right.
state.
Even though the
Period.
voters are the ones that voted to
Period.
create the
Right.
districts.
Exactly. Yeah.
I missed the committee hearing. I just made the tail end of it, but
For the new bill.
no,
Oh,
from
for
the
the brief,
first
yeah.
one, no, but but there was like an over an hour testimony. And we had, some abatement districts that gave testimony for years to do as well, but, it's good that they were there to stop that one. We'll see how this one. And then this morning there was a bill that was introduced that will get a hearing on changing daycare supervision requirements to reduce the requirements, which last year they tried to do also, and then they had sent it back to amendments. Sounds like the bill sponsor wants to, so currently, if you have like infants sleeping, you have to have visual, sight, and sound. They're trying to eliminate having to have both, either you have sight or sound, but that is concerning to us. We had a fatality of an 11-week-old last year, I think, and because that was not adhered to. So we would.
At a facility?
Yeah.
Oh, wow.
And then they also want to separate, if you're a family daycare and you have your own children, that those shouldn't count in the number of children that you're licensed to, or that count in the.
Because you don't have to watch that.
That'll be, the kids will be running the daycare center.
Your kids are outside playing in the
street.
wherever.
Yeah, they get their bikes to the street.
We'll be watching that one.
Yeah.
I'm sure we'll be able to hear about that one this afternoon in our executive council meeting. But yeah, those are two that didn't make it on the list.
And I don't want to thank you for doing this. I knew you would be involved in it, so. I figured you would. I really.
It's important too.
Yeah,
A lot of weird stuff going on.
weird stuff. There is I guess a bill that's gonna dictate and define how that rural health transformation money gets doled out. And they're setting some criteria on who can participate, so.
Yeah, and I briefly talked about that on the last page there.
Yeah.
Yeah.
64.
And there are some other topics that we know are kind of probably coming. I don't know to read it out into public yet.
Well, there won't be, I mean, there'll be a mad rush probably in somewhere around 10th or 15th March, and then they'll want to be wrapping up by the end of March because it's an election year. So generally speaking, it'll be that last couple of weeks that there's a lot going on. Really need to be very careful. Sure that we're covering that.
One thing I will say that committee meeting for the cottage foods bill, the reaction by the committee seemed to be, because there was testimony, Russ and Mike King both testified, that how many foodborne illnesses there are anyway, and the health districts provide oversight, tracking and all of that. And the response was, well, you know, you're doing all this regulation and you're still seeing all those foodborne illnesses. So therefore we don't really need any more regulation.
said that?
Pretty much, yes. Wow, reaction. You know, you're doing all that, and it's apparently not doing that much good anyway, because look how many more illnesses there are. So,
Like I said, if you're wearing a seatbelt, you still get hurt, so why wear?
so why not seatbelts?
I grew up without them, so.
We all did. Right in the back of the pickup.
Drink out of the garden hose.
Right.
Yes, it did kill me. I'm killing myself now.
Yeah.
Most cars could only go 40 miles an hour.
I shoot.
Shop.
The one is the slow is the over 130, so. I know when my speech stroke was 70. It's a thrill.
Was that with your little brother riding it? You?
No, that was me. Yeah, well, yeah, I was pretty young then. Okay. Is there anything more on the executive?
No, I think that's it.
Director's report.
The agreements, contracts, subagreements that I've approved are, since our last meeting, are in the back for your review. If you want, if you have any questions, let me know. I did want to make you all aware that I issued a consent order since the last board meeting, and I actually haven't done one of these before. But we had a licensed installer who was, that we learned last summer had installed a septic system without a permit. And that's a violation of the law. So we educated him and to do it right. And had that in verbal and writing, and then ran into another situation with him late last year. And where he did the same thing again. And so we were consulted with DEQ on how best to handle that situation. We decided to issue a notice of violation and to suspend his license. His license. DEQ made a recommendation to do that for a period of 2 years. So that was the notice of violation that went out. He came back to us and requested a compliance conference, which the law allows for, and also submitted a letter of taking ownership of his bad decisions and what he was going to do to rectify the situation and not repeat the violations moving forward. And so we met with him, reviewed that, heard what he had to say. I consulted with Mike Kane, and what we decided to do is to move forward with issuing a consent order. And the consent order basically allows him to continue to make his living, but requires quarterly reporting on anything that he's installing for a period of 2 years, and then to also give us a copy of his policies that he said he has since adopted in his company to help mitigate those future violations.
Did you even find out about that?
I'm not sure we found out about the first one. The second one, property owners called because, and this is where it's like, it's a little bit hard for our staff in the sense that it gets a little bit emotionally frustrating. The person installs tanks. If the whole system needs replaced, like the drain fields, they won't do that. So the property owner's basically paying for a permit twice potentially, and ending up paying at least twice the cost, because the cost of what they're charging for a tank is what really the system should. Yes, is what mostly a system would cost. So unfortunately, people don't know maybe what questions to ask or think to get bids. They've been taken a little bit by this person. So that isn't a violation of the law, unfortunately, but the other things were. So that's what we focused on. And I don't know about the first one. Do you know if the first one was a complaint that we received as well? Or
I don't off the top of my
I
head.
don't know how we came to know about that one, but.
Occasionally we'll, we'll be in areas where others are going in and then we'll notice something like, oh, what's going on over there, and so the inspector will just drive by and check it out. So I don't know if that was the case this time, it was Josh was inspector. I don't remember. It was right when I'd only been here a couple months, so kind of went over my head there. Now so we get either things like this where the homeowners calling and asking questions. Sometimes we get other, homeowners nearby calling us, and other times we just happen across them.
So this individual is still going to be installing tanks.
Yes. I mean, they're licensed to do that. Okay. So,
And the DEQ went ahead and did mitigation and said, okay, Jim.
yeah, just the consent order basically held some, like, if they violate the consent order and get caught doing this again, then we'll have options. We could revoke his license. He could be fined. We'll have options. We left the language fairly open just based on our legal counsel's recommendations.
Where everybody
What the
make
penalties
a
would be.
make a living, but that's not as expensive to taking people to the homeowners, taking their shorts, I just hate that.
Yeah, we don't like it either, but that's.
So he's still able to not do the whole installation though, right?
Yeah, I mean, you can do that.
Is he counting it as a repair because the tank was failed, but the drain field was okay, or?
Well, I mean, it depends, because it can also just be a new system too. So he's just telling me, hey, we do the tank, but we don't do the drain field. You got to get somebody else. So I think he's actually telling them, but they don't understand what that means from a cost perspective and a permitting perspective. So they'll do the tank and then they're like, hey, we're out.
Yeah.
And then they're like, okay, now you need to get someone to do the drain
Well,
field.
doesn't your inspector inspect it as a system? How do you
Well,
inspect the tank and not the drain field? How do you pass?
yeah, you can't fully pass it, which is exactly why you have to get a secondary permit. So we can say the tank has been installed correctly. And so that part's okay, but it doesn't like pass the entire inspection. But it's not against the law for him to do that either.
Sure.
So it's really distasteful. So it's gonna be on our short list of things to do, because we can't really like offer like, hey, use this person, not that person.
Right.
But we can give like helpful tips and tricks. And so that's gonna be something we're working on. Like, here's the questions to ask your septic
That's a
consultant.
good idea.
And so that way, if we can educate the public a little bit more, hopefully we can
Yeah,
weed that, at least
can see that.
limit it.
we have a lot of people moving here that have no idea what a septic system is.
Yeah,
It's never
all
lived
different.
in the country, don't understand. And I can see how they can be taken.
Yeah, and along with that is not just in this case, but because they don't understand them, they don't use them correctly. And so we get high failure rates.
Sure.
And so that will be another thing we're gonna try to work towards education that we can give after we inspect them, like, hey, by the way, it's really important, don't do these things.
Yeah.
If you wanna save yourself a lot of time and effort.
That's
Interesting.
one item. And then the last one I wanted to just check with the board on, one of our goals this year was to get headshots of our board members back up on our walls, which we used to have a long time ago, and then we painted the walls, we took them down, we put them back up, like, probably 10 years ago. Anyway,
Yeah.
it hasn't been that long, but a long time.
10 years.
Long time. So we'd like to do that, but we wanted to see, you guys could give us headshots, or if we wanted to have them like, well done, where you guys all have the same backgrounds, we could have somebody come in like at the next board meeting and just for your convenience. So give you guys an option. Either way, we're gonna put your headshots up.
I want the one.
Either way, you're
I
gonna do
want
it.
the one I had started here.
I was gonna say, how's that an option?
I want the one that I had when I started here.
Do we have a
16 years ago.
meme?
He's gotta wear his neck collar.
You need an avatar?
Can I get my avatar?
I was picturing one
With
of
the
those.
Although I was looking at a picture that they put in the directory.
Oh, the county directory.
Yeah, I'm looking at my picture and I'm going, I thought I was 15 pounds heavier than I am now and a whole lot younger.
That's a wash.
Oh, younger. We can just put my old picture right there. That was when I first started here 16 years ago, so that would be just perfect. Anyway.
You have a new one.
Which one? The one that I see. Oh, you did? Yeah.
We have a connection to that.
So you guys roll.
Oh, yeah. Stop being pro. I know people.
You want somebody to come in and take headshots, or you want to just?
Whatever, how do you want it to look on the wall?
I mean, I think some of the other districts have them up and it looks nice when they have like the same background. Yeah. So that would be my preference, but I know some people are in person.
You're just gonna do it here then?
Yeah, we just have them come in and bring their setup and.
When?
Next meeting.
I might not get reelected, so I shouldn't have to do it.
That goes for all of us.
Mine's this year, so.
Mine is too.
I will reach out first to the same individual that did the photography at the Idaho Association of Counties meeting. She's a local photographer and see her availability, and I will share that date.
Okay. Yes. Thank you.
Oh my God.
Anything else from the board? Okay, and then we are adjourned. Or is there any future agenda that wants to bring up? Okay, then we are adjourned. Thank you all.